ahead and hit record. We'll make sure it goes out to everyone who's here and everyone who has registered. So thank you so much for joining us today. The grant team and I are really excited to be here and share a little bit more about this project with you. And so just to give you an idea of what we're going to cover together in the next 55 minutes, we're going to introduce the grant team that's going to be working on this for the next 3 years, as well as talk a little bit about what this grant is, what activities we have planned. Oops, have I been muted? No.
You
okay.
you just bumped on and off. You're fine.
Okay. And then also that we'll leave time for some Q&A for those of you who have questions about the process or want to be further involved. And so with that said, we are going to start with some quick introductions of the grant team. And so my name is Trina Reagan. I'm a policy strategist with Empower Missouri, and we'll be working alongside a food security policy manager who will be coming on board at Empower Missouri in the next few months to see this project to fruition. And Stephen, have you joined us?
Not yet.
All right. Well then, Melissa, how about you go next?
Sure. Hey, everybody. My name is Melissa Vatterott. I am the policy director at Missouri Coalition for the Environment. I previously, in my time at MCE, led the St. Louis Food Policy Coalition. So I have a lot of food system background knowledge and also love being in the Capitol talking to legislators about these important issues.
Thank you. Dr. Kendall.
Thanks, Trina. Hi, everyone. My name is Annette Kendall. I'm at the University of Missouri, Columbia with Extension. So my work, I'm the state specialist for rural innovation and economic development strategy.
Thank you. Dr. Haltine Massengale.
I am Sarah Massengale. I'm a state specialist in community development with University of Missouri Extension, and I have a joint appointment with University of Missouri St. Louis. I'm excited to be here.
Wonderful. Luke.
Hey, everybody. Luke Peterly. I'm an extension specialist with Exceed. So I'm on the regional economic development team here in Columbia. And yeah, I love working on all things food. So really excited to be on the team.
And last but definitely not least, we have Sarah Riley.
Hi everyone, Sarah Riley. I'm with MU Extension Business and Community Development, and I do project coordination.
Great. So this is the whole group that will be working with you and the communities as we move forward with this project. And so just to give you guys a little bit of information, I've talked to several groups over the last couple of months as we've received information about receiving this award. But for those of you who haven't been a part of those meetings or conversations, we are very excited because we were awarded a $1 million capacity building grant through the Healthy Food Financing Initiatives Partnership Program grant. So this is a new grant that was released by HFFI in fall of 2023. And the grant partners that are talking to you today came together to submit an application for this national opportunity. The HFFI federal program is funded through USDA funding. So this comes through the Farm Bill. And there were 55 applications submitted across the country. We were one of 16 chosen for funding, which is really exciting, and only one of 3 that are specifically focused on capacity building. And so by capacity building, we mean building the capacity within our state to create a statewide healthy food financing initiative. And so this is a map. Just so happens the other capacity building grantees are in Southern Illinois and Knoxville, Tennessee. So that's sort of our peer learning group for the next 3 years. The others are also doing capacity building, but they're doing that along with generating loans. And so until we have a healthy food financing state initiative in place, we really can't do that loan making or grant making. And so we're just kind of starting at the beginning of the process while some of these states are further along than we are. And so in terms of what a healthy food financing initiative is, you'll see it called by this name, HFFI. You might see it referred to as a food financing program. Essentially, these are either regional, state, or national programs that look to provide technical assistance, grants, and loans to projects that are focused on increasing healthy food access in areas of current low access. So these are often talked about as two types of projects: healthy food retail projects. We're talking about the selling of healthy foods, so co-ops, grocery stores, farmers markets, anything that is going to increase or expand access to healthy food in an area that currently lacks that access. Food enterprise projects are really along the food supply chain. So that might be a food hub that farmers put together to aggregate local foods to then sell to institutions or grocery stores. It might be looking specifically at transportation and how we're getting local foods to and from farmers to places where they can be sold. So the enterprise projects really work along that supply chain to increase access to healthy foods. So those are just some common terminology that you'll see as we talk a little bit more about what these projects are. And I'll say, the last thing I'll say is the reason that they have created separate funding mechanisms is that often in areas of low access, there's a reason that a for-profit or typical grocery model hasn't worked. Perhaps there is not enough revenue to support a traditional for-profit grocery store. And so really healthy food financing was meant to create grant and funding and loan opportunities in areas that perhaps it's a bit of an unconventional project, like a nonprofit grocery store. Or perhaps there's more risk involved because it's not a model that has been done a lot. There's a lot of innovation happening in this space. And so it's hard for banks or lenders to quantify the food projects and as you would for a typical loan. And feel free, as we're talking, to enter any questions you have in the group chat. We'll keep track of those and we'll go back to them during Q&A. So just one example that I'll provide. So this, the very first Healthy Food Financing Initiative project at the state level happened 20 years ago. Pennsylvania is really seen as a leader in healthy food financing. And it was the Pennsylvania Fresh Food Financing Initiative that actually was so successful, it spurred national investment by the USDA. So it was the first HFFI program in the country. It was created in statute by the Pennsylvania legislature, and they seeded that initial HFFI program with $30 million in state funding. Throughout the 6 years that this project was going on, they were able to leverage an additional $145 million in funding. And in the 6 years, so it ran from 2004 through 2010, they funded 88 projects across rural and urban Pennsylvania. In total, they had about $85 million given in loans and grants. They have estimated that that created a total of around 5,000 jobs in those communities that were awarded those grants and loans. And it created a new 1.67 million square feet of retail grocery space. So it's considered the first and one of the most successful examples of healthy food finance that a lot of states kind of look to as an example when they're starting this type of program. I put a link. We will share these slides with you if you want to look at a more detailed case study of the Pennsylvania program. So as I already mentioned, the Missouri Rural Food Access Partnership is started around this grant opportunity. It is a 3-year grant starting this month and going through June of 2027. In these years, we really have two components that we're going to be working on simultaneously. One part of this, which some of my grant colleagues are going to talk to you about, is how we build a pipeline of fundable projects in rural Missouri. And so for those of you who live in the urban areas of Missouri, Kansas City and St. Louis in particular, there's already been some healthy food financing projects that have been funded and some work that's gone into that. Much of that funding has come through the national HFFI effort that is funded by USDA. What we don't see in Missouri is any HFFI funded projects in rural Missouri, where we know we have some high need areas that are lacking healthy food access. So part one of this is that we really want to partner with some of our rural communities to help bring to light what potential projects might be most helpful in increasing food access, and create a pipeline of projects so that when we get to the funding stage of this, that those projects are there and ready to go. So you're going to hear from the MU Extension team a little bit about how we're going to be looking at that in a moment. And then the second part of this, Missouri Rural Food Access Partnership is a little bit of a misnomer, because the second part is about creating a statewide healthy food financing program for all of Missouri. And so while this project does have a specific interest and focus for some components on rural Missouri, the rest of this is also around building a statewide HFFI. And so the reason we're coming to you today is we need to build a really robust statewide partnership of individuals and organizations that are interested in helping to move healthy food access forward through this venue. So first, we're going to build that partnership. We're going to work together to figure out what we want a statewide HFFI to look like in Missouri. And then we're going to work together to advocate for the creation of that healthy food financing initiative, as well as the funding of it. So that's a broad overview. We're now going to dig into these different components in more detail. And so, Luke, I think I'm turning it over to you at this point to talk a little bit about how we're going to use data during this process.
Yeah, thanks, Trina. So yeah, the very first thing that we have to do is just kind of understand what the current picture looks like. So just kind of some foundation setting. So what I did at the very beginning of this process was using all of the data tools at my disposal, just kind of trying to find every food outlet that I could glean from the internet, essentially. So this map is demonstrating, so the 6 different colors you're seeing are the 6 different food bank regions, and the counties that are in the darker colors are the 34 counties that we identified in the grant as, you know, some of those high need areas that we might focus on. But by no means are we limited to just those 34 counties. So, you know, this map, I know it's a lot, so it's really just kind of for informational purposes at the moment. What we're going to need help with from the project team is confirming the presence of these locations. So fortunately, at Extension, we have folks in every county in Missouri. So we are going to be doing some ground truthing. So basically, we're going to give folks a checklist with, you know, all of the outlets that we've identified, and we're going to ask them, are they still there? Are they not? Is there anything we've missed? And so you'll see, yeah, like we're looking at dollar stores, convenience stores, farmers markets, country stores, warehouse stores like your Walmart, Sam's Clubs, Costco, grocery stores. We're also looking at food pantries and food banks. And I am about to start entering some more data points. So like commercial kitchen space, community gardens. So there's all of these pieces of the food system that clearly I have not captured yet. But that's what that ground truth is going to help us do. So ideally, at the end of this process, we'll have a really firm understanding of what is all out there in these communities, and that'll kind of set us up for that next step. So yeah, Trina, if you wouldn't mind moving on to the next slide. So thanks to Bill McKelvey, I think he's on the call, and everybody who worked on the Missouri Hunger Atlas. That's been a crucial piece for us to understand and, like, again, kind of just set the table. So the Missouri Hunger Atlas kind of puts food access on this axis, right? So there's counties where we're looking at the need, and we're also looking at the performance. So with Missouri Hunger Atlas data, we're able to look at, for each county, what does the population look like? And then that population, how does food insecurity represented across that population? Then we also have information on, all of those diet related issues with health, obesity, diabetes, hypertension. We also have data on, the number of folks in each county who are eligible for all of those different food assistance programs like SNAP, WIC, and the National School Lunch Program. And then we can also overlay that on top of all of the other demographic factors that, we typically want to look at when we're trying to understand what's happening in a community. So poverty and median household income, unemployment, and even how affordable is the food. And so that's kind of more on the need side. And then we also have performance data. So we can look at how many folks are eligible in those counties versus how many of those eligible folks are actually participating in those programs. Because that'll give us a sense of, maybe how robust the local, support network is, right? If there's a county where there's a lot of folks eligible, but not a lot of people participating, that's something to investigate. And then we can also look at, how active the food banks are. So we have information on how many pounds of food are being distributed, both to those folks below the poverty level, but also to eligible WIC families. So again, like this is all just kind of setting the table. We're really going to need to kind of get out in the communities and actually just observe on the ground and confirm or deny what, whether or not we have the right picture. But yeah, that's going to be a big first part. And then that'll kind of set us up for everything else. So I think at this point, I can turn it over to Annette.
Thanks, Luke. So in addition to that data, actually, I just want to quickly say hi to one of my old students who's on the call, Holly. Hi, Holly. So with that data that Luke is gathering, we'll also be doing surveys for individuals, focus groups, and interviews with a variety of people. And then we're going to use network analysis to map out all the people and the different sources of food to understand the relationships between different stakeholders involved in food access. So by visualizing these connections, like you see in this example graph here, we can identify key players, understand how resources and information flow within the community, and spot potential gaps. For example, we can track how food supplies are distributed, identify influential community leaders who might be able to champion initiatives, and also see how information spreads through social networks. So doing it this way, this will allow us to optimize resource allocation, tailor our outreach efforts, and ensure that we foster stronger collaboration among all the stakeholders in the food system in that area and across Missouri. It's my quick little piece. You can go to the next slide, Trina.
So like Annette and Luke have mentioned, the food system is really complex and there's a lot of players and stakeholders involved. And it really requires strong partnerships and collaboration across all of those partners and within a community to ensure that communities have access to fresh, affordable, healthy, and culturally appropriate food. So it's farmers, businesses, consumers, processors, all of those are key players, but we also need to think about including schools, transportation networks, economic developers, public health, and many more stakeholders. So as we work to improve access and strengthen our food system, our conversations and plans have to include a wide representation of partners within our communities. And so the next slide, we're going to really use this project to help support community engagement through the Missouri Eats program. Missouri Eats is a program from MU Extension that's a community process that's really designed to create space for a wide range of community partners and members to talk about what's working and what are challenges within the local food system, create an action plan to address opportunities, and then work the plan to create a more thriving and equitable food system. The program is usually a 1 to 2 year process, and the starting point is a community-wide forum for participants to engage in an informed and facilitated discussion about the local food system. So this event is the first step of a larger community organizing process that engages residents to make positive changes over time. The format allows for broad discussions related to agriculture, hunger, health, and other related topics, and really relies heavily on local input from community members, generally community members, and then also all of those partners, including local businesses and agencies. The focus is really on a community-led vision, community decisions, and then that community taking action to strengthen the local food system. So the next slide. Through this grant, we'll have the opportunity to partner with 2 communities per year to implement a Missouri Eats process. What's key to this program is really a commitment to engage with the community throughout the process. And then it's also a really strong collaboration between a local community planning and leadership team and MU Extension. The local leadership team will design the Missouri Eats community event that can be a full day or half day forum, along with a meal and sharing food together to discuss the food system, identify priorities, and then explore strategies for an action plan. Then throughout the year, the local team will finalize the action plan, create work groups of community members, and work to implement projects. In this grant, we're specifically focusing on at least one project in that action plan that's focused on food, retail, or enterprise, with the goal to have a fully developed proposal for a healthy food financing funding at the end of the grant. We'll provide ongoing support to the local leadership team through Extension and our HFFI grant team, conduct annual check-ins with the community, and help ensure that the action plan doesn't just sit on the shelf. So there's several benefits to communities that want to participate. Usually this program would have a fee of about $5,000 per community, but that's written into the grant, so that part is covered. There'll be a small amount of money available to support the event and the planning process in the community. And then the main benefit is really that community identified action plan and priorities that you'll be ready to propose for future HFFI funding opportunities. So then the next slide, real quick, I'll wrap up. We will be opening a short interest application process at the beginning of August. We are intentionally making space and time in this grant to build capacity in communities. So you don't have to be shovel ready with a project right away to submit an interest form. We'll be selecting communities based on geography. So community can be defined broadly, but we'd really like to have as part of it one of the 34 counties that was identified in Luke's map. But we'll also be interested in applications that have a rural, urban, or regional collaboration potential. A second priority will be based on indicators of food access and infrastructure opportunities and challenges, plus community identified food system issues. And then finally, one of the really important parts is a focus on community engagement and willingness to bring diverse partners to the table and engage in the community, work outside our traditional silos, and spend the time it takes to build those partnerships and relationships. It also will really require some local leadership, whether that is informal leaders, community members, but people that are willing to take this on in the community. After the interest forms are submitted, we'll narrow the pool and do some more in-depth conversations with those top applications to choose the first 2 communities for this year. We're also hoping to understand interest broadly and build a pipeline of communities and projects for the future 2 years. So even if you're not quite ready yet to maybe participate this year, it's still okay to submit an interest application. That way we'll have a sense too of where communities might need some additional support to apply in the next 2 years of the process. So watch for the interest application. It'll be open later next week, beginning of August. And if you have questions, we've included the website on those pages for the Missouri Eats. There's more info on that website, and feel free to email if you have questions. So thanks.
it
And
helps
these are,
if
go
I'm
ahead.
unmuted. So thank you, Sarah. This is just a list of those 34 counties that are included in the initial outreach for Missouri Eats communities. In case you're curious about how these were selected, this was a combination of looking at Missouri Hunger Atlas data, as well as if you go to the reinvestinginfood.com website, which is the national HFFI website, they have eligibility that looks at a variety. This is eligibility for the national grants, but it takes into consideration things like the USDA's low income, low access, census tracts, etc. So these are the first pass counties that we would like to try and engage with. And we would love help figuring out who some good contacts are in these counties to make sure we're reaching the right people with our ask, and to explain the project and see if there's interest in participating. Again, if you guys have questions, feel free to put them in the chat. And so a little bit more about what we're envisioning for the second component of the project. So Luke and Annette and Sarah just covers the data analysis, the research that we're going to be doing, and how we'll collect, or how we will identify those Missouri Eats communities. The second half of this project is really building that robust statewide partnership in order to advance the idea of a statewide healthy food financing initiative. And so just to reiterate, I've said this once before, but it's open to any individual or organization that's interested in helping to shape what a statewide HFFI would look like for Missouri. If you look at the states that are doing these, there's a different flavor to how each state does it. I saw some great questions about how pantries or gleaning efforts, or even the local and regional food systems can be involved. And that is up to the group to really look at the data and determine how they want an HFFI program to function in the state of Missouri. Do we want it to engage our farmers and our regional food systems more deeply and build on those? Do we want it to interlap or overlap with some of the other efforts that are going on around food insecurity or food as medicine in our state? Those are the discussions we'll be having over the next few months as we are talking about what do we want to see put in statute. When we define what HFFI is for Missouri, we want everyone who has a vested interest in this to come to the table to have those discussions about how do we create this network across the state that ultimately is going to maximize healthy food access for all Missourians. And so I just want to encourage everyone's voice is welcome here. Yes, we want to hear from you if you work with senior populations, if you're working with children, if you're working with families, if you're working with veterans. We need to know what the needs are, as well as what are the resources out there that we can build upon that already exist. Someone mentioned something around like home delivered meals, right? Transportation and delivery is always an issue in rural areas. How do we get that last 10 miles of getting groceries to people? So I'm just going to encourage you. We don't know. We get to build what this looks like. And so I'm going to encourage you, if you're interested, to express that interest and participate in those discussions that we're going to be having. And again, this will serve areas both urban and rural once we put together this statewide initiative. And so there's a form that you can actually see it at the bottom of this slide. We'll put it up again before the end of the webinar, but you're welcome to sign up for updates, as well as reach out to me if you'd like to have some conversations. So in terms of what we want the partnership to do, we want to engage statewide stakeholders. We want to create then that framework that's going to guide the development of a statewide HFFI and how that runs here in Missouri. We're going to advocate with our state legislature to get that HFFI put into statute. We're going to hear from Melissa Vatterott in a second about what some of that advocacy work is going to look like. And then the last and probably the most difficult part is we're going to fund it. And so what does that funding look like? Our goal is a public-private partnership. That is the goal nationally when they fund these projects. How can we utilize both state funds as well as draw in some private funders to this work? So there's two specific groups outside of kind of what I just described that we're going to try and engage with. One, we need to create a lenders network here in Missouri. So part of doing this work is the creation of a statewide network of lenders who are going to work together to design a lending portfolio that complements whatever we create as our vision for HFFI in this state. So that is going to be a mix of grants and technical assistance and loans. And it's going to involve our CDFIs, our Community Development Finance Institutes. It is going to involve, we have micro lenders. So we're going to want to make sure we have a robust lenders network that covers all areas of the state, urban and rural, and a wide variety of lending opportunities. And so Stephen Westbrook couldn't be here today, but he is with IFF. They have experience standing these programs up and administering them in Illinois and Kansas, among other states. They have already agreed to join and help form this lenders network, but we're really looking for lenders and different finance opportunities to join from throughout the state. The second is a healthcare affinity group. So my background is public health, so I'm wearing that hat. But of course, over the last few years, we have seen a lot of interest in the role that social determinants of health and health-related social needs play in people's overall health. And part of a big part of that is access to healthy foods in your community and how that impacts your health. So we would love to connect with health insurers, health systems, healthcare providers that are really interested in looking at how healthy food access in areas of low access can help us. How can they help us stand these projects up in a way that benefits their patients and their communities where they're trying to improve health outcomes? And so if you have those connections, if you are one of those people, please reach out so that we can bring people together, raise some awareness and do some education around what healthy food financing is, and talk about what role our healthcare system can play in expanding some of that access. And so I'm going to turn it over to Melissa now, who's going to talk a little bit about the stakeholder education and engagement piece of this puzzle.
Thanks, Trina. Great to be with everybody. As we've outlined, many of the reasons that this work is important and the geographic areas where the need is greatest. In order for us to be able to advance this work, we are going to need policy change from our state legislators. So during the time where we're ground truthing the needs and the existing food environment across the state, I will be working to communicate with our state legislators and their staff about what the state of food security and food access looks like in our state, what populations are going to be most, burdened by limited food access, and the various benefits, like Trina said, of having innovative projects like this. If we can speak to the healthcare benefits, if we can speak to the child student performance when we know that they have, that they're nourishing their bodies. I plan to share that type of information with legislators. So by the time that we are ready from the work that's being done through this project to come up with a legislative proposal, we have legislators who are already familiar with the issue and understand why it's a priority. My intention is to prioritize legislators that represent the districts where the burden is greatest, as well as legislators on a few different committees that I suspect the legislation could go to once introduced. This includes the agriculture, and I'm very much abbreviating. If you go to the House or Senate website, some of these committee names are actually quite longer than what I've written here, but the Agriculture Committee, the Economic Development and Tax Policy Committee, Health and Welfare Committee. As each session changes, legislators will be on different committees, but I'll try to make sure that I get to the legislators who might be sitting on the committees when our language moves forward. And then also making sure that champions of food security work, of improving food access, not just through tax incentives or tax breaks, but also those who are in support of supporting local food production, making sure that they know that we are working on this issue, because they may want to be champions of the language that we come up with as well. So I'm very much looking forward to that. And if folks that are on the call today have, certain insights on legislators that you've communicated with that might be receptive to this work, I welcome it. If you have certain data point, if you're a nerd like those of us who are already in the project and have great data that you want to share, I bet all of us would welcome it. So thank you for the opportunity to chat today.
Thanks a lot, Melissa. And so this is a brand new project. I saw a lot of great questions coming in, and we'll get to those and discuss those. Part of, I think, the discussion we're having is that we don't have all the answers right now. This is a capacity building process that's going to involve all of you. And so we'll answer what we can for you today. But some of these are conversations we're going to need to have to determine what our priorities are for a statewide HFFI. In terms of next steps under the grant, I just looked ahead to the next 3 months to give you guys an idea of what we're going to be working on. So as Sarah mentioned, we're going to finalize and distribute that application for the Missouri Eats program that she described. Help us get the word out about that. So do you have contacts in the eligible counties? Do you know of some innovative work that's going on there? We would love your help to make sure that we can reach the right folks in some of these underserved counties and engage them in the process. Also, are you interested in being part of the partnership? We have the grant partners at the table, but now we need to expand it to statewide representation. And so if you're interested in participating in these conversations and helping to discuss what we want this to look like for Missouri, please let us know. So you'll have a chance in August that you can sign up to be a part of ongoing conversations that we'll be scheduling to discuss what our options are. Next month, we're also going to be focusing on that lenders network. I saw at least one recommendation come through, and we're also going to be looking for interested healthcare partners. So that's going to be snowball sampling on my part. Any recommendations or introductions you want to make are definitely welcome. If you're interested in and want just to talk through this a little bit more, we'll be scheduling some initial meetings in September to talk to organizations that want to join the partnership. And then in October, we'll be holding those initial meetings. So the next 2 months is sort of gearing up with the goal that in October, November, we'll be bringing all of these different groups together to really start that process. And so, Kim, I'll just answer right now. I saw your question just pop up about an MOU. We're working on that right now. And so the idea is that we'll have some discussions about what role you'd like to play. And then there will be kind of a general MOU agreement for those who would like to be part of the partnership. And with that, I want to thank you all for joining us today. This is a chance for us to have a discussion. So what questions do you have? What ideas do you have? Please go to our website and sign up to receive updates as the project moves forward. My goal is that we send those out fairly regularly, at least quarterly, to those who sign up for that. If you know of potential partners, as I've reiterated multiple times, please feel free to reach out to me and we can schedule a time to talk or make those introductions. And so with that, I know I wrote down some questions that I saw early on in the chat, but I also want to open it up for folks to ask questions. So if you would like to come off of mute, please feel free to raise your hand if you have a question for any of the grant partners, and we'll take you off of mute. And if there isn't, I can read some of these questions that came through on chat. And yes, I will drop that into the chat. Oh, Jet's got it. Never mind. All right. So one of the questions I saw is about the role for, is there a role for pantries and gleaning efforts that are rescuing and harvesting food? And I will just say that the idea behind HFFI at the national level is to create retail opportunity. And one of the contingencies is that the retail opportunity accepts SNAP benefits. So it's to create opportunities to accept the federal nutrition programs. And so that is something that we can discuss. I think if there are already, this goes back to that network that we're building, right? So if there are already very active pantries or gleaning programs, how can we utilize or tack on to that work that's already being done to improve access in the community? Luke, it looked like you already answered a few questions about the role of food pantries and the data. Did you want to add anything to that?
Well, actually, Trina, now that you mention it, I had responded to a comment about congregate care sites and some alternative, some other places that we hadn't considered. But yeah, actually, having just heard that there's that SNAP focus, I don't know if that would be appropriate to include. I mean, maybe we want to just include those to have the full picture of what's happening in the area, but it might not really factor into kind of our ultimate decision making. Am I kind of thinking about that right, you think? Like we should gather the data, but it might not necessarily matter too much in terms of like selecting that final project.
I think based on how it's structured at the federal level, the idea is, and I think I saw someone put this in the chat, like it's around standing up sustainable projects in the community. And
Right.
so, talking about what that role is, that some of the existing partners and programs can play, I think is really important because those are probably folks who are really involved in the food system.
Right.
However, typically this has been either non-profit or for-profit projects that are able to kind of project through market analysis that they're going to become sustainable after receiving kind of the grants and loans and technical assistance. All right. Charles, did you have a question?
Yes, thank you. So if you like focus, for example, on Morgan County, I think that was one of your counties listed. Would it be more ideal to have the county health department as the kind of the sponsoring agent to kind of lead an initiative, or or maybe I'm with the Boonville Farmers Market, and our bylaws call for Cooper and surrounding counties, which picks up Morgan. So it's kind of like more of a food shed around the Boonslick area. How do you see that combination, the regional approach versus a more centralized county approach?
I think you know your area best. So in some cases, it might be a farmer's market that serves, the county seat and surrounding areas. It may be a multi-county region. I think that's not up for us to determine so much as for you to look at based on your partnerships and what you know the reach to be in terms of who it makes sense to engage with. I know there's some food hubs in the works and they're multi-county food hubs that are looking to, engage anywhere from a 3 to a 6 county region. They're looking at how that engages with their farmers markets. How does that lead to food retail? What does delivery service look like? And in some cases, I'll say someone might be in a nonprofit space or a space that currently doesn't support a sustainable revenue generating model. However, maybe what they're doing can lead to that or provides a foundation for that to happen. So I'd love for us to think outside of the box. My personal passion is really figuring out how we engage the regional food system in this, and take advantage of the fact that we're in such an agricultural state, and there's so much food being produced here. And how do we get that into the hands, all of that healthy food access into the hands of our neighbors?
Thank you.
I might just add too, Charles, that for the Missouri Eats process, I think we're really going to be looking for projects or applications that are willing to work across silos. So we're going to be asking to have a local leadership or planning team. And so that should be anywhere from, 3 to 5 members that like of a core team. So really like the strongest ones are going to be that partnership and collaboration. So I think, the way that you were talking about it, a great project would think about how could you leverage both of those organizations, the farmers market and the health department, right? So thinking through how can you work to cross some of those traditional silos and bring more diverse participation to that local team. So
Thank you.
I see we had a question on how we are defining rural. I can tell you how we defined rural for the grant application. And that was in looking at a definition that was used by, I believe, Missouri Department of Senior Services for a rural healthcare report that they do, I think, either annually or biannually. In total, I believe there were, and then we crossed that data with HFFI eligibility criteria. And so first we looked at how our state was defining rural, and I'm going to be honest, I found multiple definitions of how people are defining rural. And then we crossed that with eligibility data according to our grantee. So in terms of how we define that for a statewide HFFI, that's a decision we can have, because from what I could see, the definition I saw for Missouri Department of Agriculture was different from what I saw on the DHSS website. So it seems like there is some room for discussion. And I don't know, Luke, Annette, Sarah, you guys deal with kind of categorizing this data more often than I do. Do you have any guidance there?
I was going to throw to Luke because you guys do it quite a lot with your Exceed data, right? I mean, I'm the same with you, Trina. There's so many different definitions.
Yeah, so I think the way we tend to think of it at Exceed, so there's your metro and your non-metro, and that's a classification at the federal level, right? And so we tend to think of rural in a couple different ways. So, there's counties that are directly adjacent to a metro, that they're going to look differently than a very isolated rural community, right? So like, for example, Randolph County, just north of Boone. Here, we've Columbia here, and Randolph isn't considered a metro county, but Moberly is a fairly big city. They're fairly close to Columbia. They're going to look a lot different than like Schuyler County, for example, all the way up on the Iowa border. So it's tricky because ultimately, I mean, we want the ultimate beneficiaries of these things to be those underserved rural communities. But yeah, like as Trina mentioned, I mean, you folks are going to know much better than we will what your region actually looks like, right? Because ultimately, federal data sources aggregate things at county level, census tract level, block level, but that's just an administrative decision that gets made. People's lives are messy and lived across borders. So this is really a long way of saying I'm not sure, to be honest. I mean, I don't know if there's actually like any kind of definition that we have to follow based on the grant language. I mean, we're pretty free to kind of interpret it as we want, from what I understand, within reason, of course.
Yeah. They have their own definition of, at the national level that comes out of the USDA in terms of how, if you apply for a national grant, they define rural, frontier, that sort of thing. However, there's some wiggle room in how we talk about that here in Missouri. I think I already said that we use DHSS definition for this particular grant application. Someone asked if we've reached out to community partnerships, and we have not yet. This is a very new project, so we're just now getting to the point of making those contacts, and would love some help making those connections. Any other questions? I want to thank everyone for joining us today. Jet, we can go ahead and stop the record. We'll get this out to everyone. I'm happy to stick around, and if the rest of the grant partners could as well. And happy if you guys have specific questions about your area or your project.